All right, strap in, everybody. We're going deep on this one. It's a story with science, politics, healthcare, and controversy, all rolled into one.
Yeah, it's really fascinating how these worlds collide, especially when we're talking about something as sensitive as care for transgender youth.
Exactly. And that's where this story takes us. We're looking at Dr. Johanna Olson-Kennedy. She's a big name in transgender youth care, and she's decided to hold off on publishing her study. This one's on the effectiveness of puberty blockers, and, well, the reasons why she's delaying are causing a lot of debate.
Yeah, and it's important to remember this delay isn't just about the data itself. It's tied up with concerns about how those findings might be used, especially given the current political climate around transgender healthcare.
Okay, so let's break down the study. It started back in 2015 with federal funding. 95 participants, all transgender adolescents, received puberty blockers. Just as a refresher, puberty blockers are meds that essentially hit pause on the physical changes that come with puberty.
Right, the goal is to prevent irreversible developments that could make gender dysphoria worse.
And gender dysphoria, for anyone who's unfamiliar, is that feeling of distress or discomfort when someone's gender identity doesn't match the sex they were assigned at birth. It's a real, clinically recognized condition, and it can really impact someone's mental health.
Absolutely.
So the study aimed to see if using puberty blockers could lead to improvements in the mental health of these adolescents over 2 years. There was a lot of anticipation around the findings, especially because earlier research, particularly from the Netherlands, suggested puberty blockers might have a positive impact.
And that's what makes the outcome of the study so surprising. It didn't find any significant improvement in mental health outcomes for the participants. Can you imagine? Researchers expecting one thing and getting something completely different.
Whoa, yeah, that's a huge curveball. It shows how much we still don't know about gender dysphoria and treating it. But then there's the political side of things, which makes it even more complex.
Exactly. Dr. Olson-Kennedy has said she worries her findings, even though they're nuanced and not a final answer, might be misinterpreted and misused, especially in the current political climate. She's concerned groups opposed to gender-affirming care might use the results to further their own agendas.
And that fear isn't unfounded. We've seen a wave of legislation in the U.S. trying to restrict or ban gender-affirming care for minors. This is despite the consensus from major medical groups that such care is safe and effective when properly done. So it's easy to see how research could get weaponized in these already heated debates.
It raises a really important question. How do we ensure that scientific research, especially on something as controversial as this, is used responsibly? How can it inform policy decisions without being distorted by political agendas? It's a challenge we face not just in transgender healthcare, but in other areas of science too, like with climate change or vaccine research.
Just like this constant tug-of-war between making decisions based on evidence and pushing politically driven agendas.
Yeah, you're right. It really emphasizes how important it is for all of us to think critically, evaluate information carefully, and consider the sources and biases behind what we read and hear.
Absolutely. With this story, it's so easy to get caught up in the back and forth. Everyone has strong opinions. You've got transgender rights advocates, understandably worried that delaying the study could fuel harmful narratives and further stigmatize transgender healthcare.
Right, and then there are people who support Dr. Olson-Kennedy being cautious. They argue that in this charged political environment, it's vital to prevent misinterpretations that could hurt transgender youth looking for care.
And of course, you have those groups opposed to transgender healthcare altogether. They're pointing to the study as evidence against puberty blockers, even though the findings are far from conclusive.
It just highlights how important nuance is when we interpret scientific research. Black and white answers are rare, especially when you're dealing with human experiences as complex as gender identity.
Absolutely. It makes you wonder, how do we as individuals trying to understand all this navigate the sea of conflicting information? How do we find those credible, nuanced perspectives? It can be really overwhelming. Where do you even start to look for information that isn't biased or cherry-picked?
That is a great question, and it makes me think about a resource I found really helpful. Podcastworld.io. It's like having a super-powered research assistant just for podcasts.
Okay, tell me more. Podcastworld.io.
Yeah, it's this AI-powered search engine. It goes way beyond just keywords. It actually understands what your question means, the context. It can scan millions of podcast conversations to find the exact parts that address what you're looking for.
So instead of spending hours going through episodes hoping to find the right info,
Mm-hmm.
podcastworld.io basically creates a custom deep dive on any topic. That sounds incredible, especially for a complex issue like this where there's so many viewpoints to consider.
Exactly. Imagine instantly hearing from medical experts, transgender people sharing their experiences, ethicists talking about the moral side of it, and policymakers discussing the healthcare implications, all in one place.
And it's not just listening, right? You can interact with the content, too.
That's the best part. You can chat with AI bots of podcasters you trust. It's like having a direct line to experts, asking follow-up questions, exploring specific aspects more deeply, and continuing the conversation even after the episode's over.
Wow, that's amazing. So if our listeners really want to understand this topic, explore the different sides of puberty blockers and transgender healthcare, it sounds like podcastworld.io could be really helpful.
It's a game changer for anyone who wants to cut through the noise and dig deeper into complex issues. You get to hear from a really diverse range of voices.
Okay, I'm definitely checking that out after we're done recording. But let's shift gears a bit. We've been talking about the U.S., but this debate is much bigger than that.
You're absolutely right. Similar conversations are happening all over the world. Yeah, it's a global conversation. Different countries are all dealing with the same questions about puberty blockers, gender-affirming care, and how to support trans youth.
It makes you think how different cultures and healthcare systems might change those conversations. What are some examples of how this plays out internationally?
Well, England's a good example. Their National Health Service did some recent reviews. They raised concerns about how well puberty blockers work in the long term and also about potential risks.
Interesting.
So because of that, some healthcare systems in England are being more cautious. They've paused prescribing puberty blockers unless it's part of a clinical trial while more research is done.
So even in places with well-established healthcare, there's still a lot of uncertainty and debate. It's definitely not a simple situation anywhere.
Right. It shows how important it is to be humble about this topic. We don't have all the answers, but with all the scientific and political talk, it's important to remember that real people are at the center of this. Young people figuring out their gender identity and dealing with tough challenges.
Absolutely. We can't just talk about data and policies and forget about the human impact.
Exactly. And one of the big ethical things here is informed consent. Young people and their families have to have accurate, unbiased information about puberty blockers, the good and the bad, so they can make informed choices about their health care.
And that's where healthcare providers, therapists, and counselors are so important. They're the ones working directly with these kids, helping them understand their options, navigate gender identity, and make the right choices for them.
And informed consent isn't just about listing side effects. It's about those open and honest conversations. Conversations that respect the young person's autonomy, acknowledge their feelings, and empower them to make decisions that fit their values and goals.
It's about treating them like individuals, not just patients. Recognizing that each person's journey with gender identity is different, and there's no single approach to care.
Exactly. And I think that individual focus should be part of the bigger conversation about transgender healthcare, too.
Yeah.
We need to move away from generalizations and stereotypes. We need to see the diversity within the transgender community.
Right. There's this tendency, especially in the media, to treat transgender issues like everyone has the same experience and views, which isn't true at all.
Yeah, and that oversimplification can be really harmful. It leads to misunderstandings, prejudice, and policies that don't truly meet the needs of diverse transgender people.
So it's about listening to individual stories, understanding those differences, and letting those lived experiences inform our opinions and our advocacy.
You know, thinking about the diversity of experiences and the need to hear from different voices, it reminds me of how helpful podcastworld.io can be.
Oh, for sure. It's like a doorway to so many perspectives, all together in one place. You can find podcasts from transgender people, parents of trans kids, medical professionals, therapists, activists, so many different voices. It's a great tool for anyone who wants to understand this topic more deeply.
And with that AI search, you can search for more than just keywords. You can ask deeper questions like, what are the ethical things to think about when giving puberty blockers to young people? Or what are the long-term effects? And podcastworld.io will find the exact podcast segments that answer those questions.
It's like having a personalized syllabus for any topic built from all the podcasts out there.
And it's not just about the information, it's how podcastworld.io lets you interact with it. You can chat with AI bots of those podcasters, ask follow-up questions, and really explore the details in a personal and interactive way.
It's almost like joining a conversation, being part of a community of people who care about learning and exploring these important things.
Exactly. And I think that sense of community is really important when we're talking about something this sensitive and complex. It helps us feel less alone, less overwhelmed, and more empowered to deal with the complexity.
Well said. As we keep talking about this, I think it's important to keep that community in mind. Remember, we're all part of this conversation. Our voices and perspectives matter.
Couldn't agree more. So with that said, let's think about the future of transgender healthcare. What can we learn? How do we balance individual rights, scientific evidence, and ethics in a world where politics are always changing?
Yeah, it does feel like we've gone pretty deep here, exploring all the complexities of puberty blockers and transgender healthcare. It's tough. Where do we even start to think about a path forward?
It's definitely complicated, a lot of layers. But I think one starting point is just acknowledging that we need more research, ongoing, unbiased research.
I think you're right on there. We can't take one study like Dr. Olson-Kennedy's and say, okay, this is the answer.
Yeah.
We need more research, long-term stuff to really see the impact of puberty blockers on trans youth.
And it can't just be about the clinical outcomes either. It needs to include the voices and experiences of transgender individuals, what they think about the benefits and risks, their quality of life, their well-being. Those are all critical pieces of the puzzle.
Absolutely. We have to move away from this top-down approach to healthcare. We need a model that really puts those who are most affected by these decisions in control.
It's about understanding that this isn't just medical, it's a social justice issue. Transgender youth face so many hurdles already: discrimination, bullying, lack of understanding and support. We have to create a society that affirms who they are and makes sure they're safe and well.
That's a call to action for everyone, not just policymakers and doctors, but all of us. We have to challenge our own biases, learn about transgender issues, and fight for policies that protect transgender rights and make things more inclusive.
And as we fight for that change, we have to be open-minded, willing to hear different sides of the story. This is a field that's always changing. Our understanding of gender identity and how medical interventions affect people will keep evolving. That's why it's so important to stay informed, have respectful conversations, and be ready to change our minds as new evidence comes out.
I think that's so important. It's easy to get caught up in arguing and lose sight of the fact that we're all still learning.
Totally. And speaking of learning, it brings me back to podcastworld.io. It's such a great resource for navigating these tough conversations. It's a really powerful tool for learning more and hearing different perspectives on transgender healthcare and so many other topics too.
I'm with you there. If you want to hear from transgender people about their experiences, or doctors discussing research, or ethicists talking about the morals of it all, podcastworld.io has it all. It's like having a library of knowledge right there on your phone.
And with the AI search and those AI bots you can chat with, you can really make your learning experience your own. You can ask the questions you care about. It really changes the game for people who want to go deeper than just the surface level. It lets you really dig into the details of these important conversations.
As we wrap up this deep dive, I feel hopeful. There are so many amazing people and organizations out there fighting to make life better for transgender youth. And we have tools like podcastworld.io that help us learn, connect, and have meaningful discussions.
I feel that hope too. And I think it comes with a responsibility to stay informed, to question our own assumptions, and to use our voices to make the world a more just and fair place for transgender youth and for everyone.
That's a great way to put it. And to all our listeners, thank you for coming with us on this journey. Keep learning, keep talking about these things, and keep using your voices to make a difference. Until next time, stay curious and stay involved.